Want to know a secret? Well, I know the secret and the key to aging gracefully and aging healthily. It's really quite simple. Want to know what it is? It's routine primary care visits and a good relationship with your primary care physician. Primary care physicians, aka your family doctor, are trained to provide a comprehensive level of care to patients of all ages, really to treat disease, but also and sometimes more importantly, to prevent it. Whether you have multiple chronic conditions or you're perfectly healthy, having a regular primary care doctor is so key to your health. And really, it prevents disease and allows you to be healthy and age gracefully. Today, we're going to discuss and salute those unsung heroes of the healthcare profession here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome, everyone, to Ask the Doc, a TV show where we encourage our viewers to send in their healthcare questions. I'm Dr. Kaur, a double board certified primary care physician, and today we're going to talk about how your primary care physician is an integral part of your healthcare journey. Our first question, oh, this is exciting. Our first question comes to us from one of our YouTube viewers, and it is from Victor. Victor says, "Hi, Dr. Kaur. I'm 67 and retired last year." Well, lucky you. I hope you're enjoying retirement, Victor. Other than a red, scaly, itchy spot on my forearm that just won't go away, I'm feeling pretty good. My wife says I haven't seen the doctor in a couple of years, so she really wants me to get it checked out, but where's the fire? Oh, Victor, 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 your wife is absolutely right, as many times we are. No matter how big or small, if you feel something is off with your body, you should get it checked out because honestly, you know your body best, right? So if something feels not right, chances are that it is not right. And plus, if it's something that can be caught early or prevented and taken care of, isn't that what we all want? Best case scenario is it's nothing. Maybe it's just something that needs to be frozen off or needs an ointment for, or again, maybe it's nothing at all. But if it is something more serious, don't you want to catch it early and get it taken care of as soon as possible? Your primary care physician can help you with a variety of healthcare concerns, which is especially important the older that we get. Your primary care physicians are often also the biggest advocates for your health. I encourage you to get a comprehensive annual physical exam with your primary care physician and see them at least once a year. The goal of these exams is to address important aspects of your health that may get missed during routine primary care visits. This is also why annual exams are longer than routine visits. The types of screening that you're going to need for your annual exam depend on your age and they depend on your gender as well. The older you are, it's understandable that you may need more screening than somebody who is younger. So, for instance, if you're 65 or older, your annual exam will include screenings for various items, such as the risk of falling. Now, as we age, just like a car that ages, we need routine maintenance. Things may not work as they once did, and the risk of falling does increase as you age. And the worst thing is, if you fall, you have a higher chance of breaking a bone or getting complications. So, we really want to make sure that you're sturdy, your balance is good, and that your risk of falling is low. Also, your risk of infectious diseases. For instance, as you age, your immune system does tend to decline a little bit, so you're at a higher risk of contracting infectious diseases, just like shingles, RSV, influenza, COVID, pneumonia. And then the most important, well, not the most important, but probably the most anticipated part of an annual exam is your personalized risk of cancer. We want to screen the cancers that you're at risk for depending on your age, your gender, your family history, your personal risk factors. And really, based on these results, your PCP may suggest that you get certain vaccines, certain screening tests like colonoscopies, mammograms, or make certain lifestyle changes because those are just as important, sometimes more important than medications, even. However, many of these screenings are now being suggested at earlier ages, younger ages. So, whereas colon cancer screening used to be a test that we started recommending to individuals at the age of 50, we now are recommending it at age 45. And this change happened after years of research shows that colon cancer is being found in younger and younger individuals. While that's happening for a variety of reasons, the main point is if you are 45 or older or have a family history or even have any concerns, please talk to your primary care physician about the screening you should get. Some screening tests have more to do with your lifestyle than your health risk factors or your genetics or your family history. For instance, if you smoke. Now, if you smoke, we want to know how long you've smoked, what you've been smoking, and depending on these questions, the answers to these questions, we may then recommend that you get a CAT scan, a low dose CT of the lungs in order to screen for lung cancer. Now, nevertheless, no matter what it is, your PCP is going to discuss what's best for you and really develop a personalized plan. So sorry, Victor, I got off on a little tangent there. I get passionate about this, but it's important to remind folks that they need to visit their primary care physician and get a comprehensive annual physical exam. Now, back to that red, scaly, itchy spot on your arm. You should really make an appointment with your primary care physician to get it checked out. And honestly, consider seeing a dermatologist for a more in-depth skin cancer screening as well. Okay, next question. Facebook. Oh, wonderful. So our next question comes from one of our Facebook viewers, and it's from Araceli. Hi, Araceli. So she asked, I'm 70 and I just moved to a new city down here in South Florida. Welcome to South Florida. I found a primary care physician I really like, but I'm having a hard time finding a geriatrician. What should I do? Well, that's an excellent question, Araceli. For those who don't know, a geriatrician is a primary care physician who has done additional training to specialize in treating the individuals who are 65 and older. Generally, we see that individuals 65 and older have more chronic conditions or have more complex healthcare needs than somebody who is younger. So primary care physicians can choose to do a residency or a fellowship to become a geriatrician. Now, the unfortunate part is that there is a scarcity of geriatricians in the United States for various reasons. Medical students and residents are more inclined to go into other specialties and parts of the medical profession. But don't worry, Araceli, that doesn't mean that you can't find a good geriatrician. Honestly, most primary care physicians have the extensive training that is needed to address the needs, the complex and chronic healthcare conditions of our aging population. So if you have a good primary care physician and you have a good relationship with them, that can be just as good as having a geriatrician. Speaking of chronic diseases, we have another Facebook question, and this one is from Samuel. Samuel says, I'm 63 and was just diagnosed with type 2 diabetes by my physician, who called it a chronic disease. I forgot to ask him what he meant by chronic, and now I'm really curious about it. Oh, Samuel, that is a hefty diagnosis, and I really hope that you are listening to your doctor and doing what you can to not only treat it, but prevent it from getting worse. Now, this is an excellent question also to describe what a chronic condition is. We throw that word around as doctors all the time and forget that the general population may not know what it means. Well, chronic diseases are defined as diseases that can last for 1 year or longer and require ongoing treatments, medications, and interventions. There are some conditions, though, if they last more than 6 months, they're termed chronic. So anywhere from 6 months to 1 year. Basically, it's something that's long term. And these chronic conditions do tend to occur more the older that we get. And as I said, they do require ongoing medical attention. Even if you're not taking medications for them, they need to be continuously monitored every 3 to 6 months to make sure that they're well controlled and that they're not getting worse, because that's the bad part, right? And aging does increase your risk of chronic conditions. One of those examples is heart disease, type 2 diabetes also, and then arthritis, cancer, the list goes on. These are also the leading causes of death and disability in the United States. So we take them very seriously and we really, really want to help you manage them. Now, many chronic diseases are caused by a short list of risk behaviors. And these risk behaviors differ for everybody, but these are the general ones. Now, the first one I want to talk about is not having a healthy diet and having poor nutrition. Now, this includes diets that are low in fruits and vegetables, that are low in fiber, and high in sodium and saturated fats. Now, I could do a whole seminar on why fruits, vegetables, the macronutrients, the micronutrients are so important for your body. But I think, if anything, the pandemic taught us how important eating healthy is. It improves your immune system, it improves your mood. So you definitely want to be cognizant of what you're putting in your mouth, what you're eating. Now, that's not to say that we don't all enjoy some junk food once in a while, a piece of chocolate, a bag of potato chips, but these are not things that should be a regular part of your diet. And if there's any piece of advice I could give to anybody, more fiber. Fiber does wonders in your body, so please make sure you're getting the recommended daily amount. Now, the other risk factor I want to talk about is tobacco. So smoking it or chewing it is a risk factor for various conditions and cancers. Now, exposure to secondhand smoke is also a risk factor. So I want people to know, even if you don't smoke, but your partner does, somebody in your house does, and you're constantly exposed to that, that can also cause some damaging effects to your body. We all know that smoking can cause lung cancer, but there's other conditions that it can cause too: repeated lung infections or upper respiratory infections, oral cancers if you're chewing tobacco. So really keep that in mind. And if you are somebody who uses tobacco in any kind of form, talk to your primary care physician. There are ways to quit, there are ways to reduce, and we would love to help you with that. It's a long journey, and it's one that we will happily guide you through. Now, the other one is lack of physical exercise. Now, physical exercise, well, I should say physical activity, is any movement that your body does. So going from here to the bathroom, technically that's physical activity because you got up and did something. But exercise is what is an intentional activity that produces an increased heart rate and increases your baseline, everything that's going on in your body. Basically, you might sweat a little, you might not be able to talk if you're engaging in really vigorous exercise. There's different levels of exercise, and you do what's best for you. I always say, don't go from 0 to 100. You got to do it slow if you're increasing for the first time. But whatever it is that you do, physical exercise is so important for your physical health, your mental health, your spiritual health, all the healths. You'll notice that even 30 minutes of just going for a brisk walk every day is going to help improve your mood, your digestion, your memory, your sleep. Oh my gosh, the list goes on. But yes, physical exercise. And then the last one I'm going to talk about is excessive alcohol use. Now, unfortunately, we did see this increase in the pandemic, and hopefully that's coming down. But to be honest with you, excessive alcohol use has been linked to so many chronic conditions and diseases and bad things in the body that we really encourage cutting down. Now, I want to make a note: alcohol use, especially if you're doing it on a daily basis, you're having more than 2 drinks, more than 1 drink even, we never encourage individuals to stop it altogether because that's a risk as well. So talk to your primary care physician, see if you have concerns about your alcohol intake, and if so, the right way to come down or to reduce it. I didn't forget about you, Samuel. Type 2 diabetes. Now, this used to be known as adult onset diabetes. They changed the nomenclature several years ago, but basically it means that having diabetes, your body either doesn't make enough insulin or doesn't use the insulin that it is making, and because of that, the glucose increases in your bloodstream. Now, when glucose, or for simple terms, I'll call it sugar, increases in your bloodstream, it has so many damaging effects to a lot of parts of your body. The first one that comes to mind is your nerves, because when sugars increase, they damage the nerve, and you can get neuropathy, which I know many individuals unfortunately suffer from. But you know what? There's ways to prevent it, to treat it. Again, it's all about that relationship with your primary care physician, who can educate and guide you on the best ways to do this. We can prevent diabetes, screen diabetes, diagnose it when it's there, and give you the best treatments. So keep that in mind. Now, medications are needed sometimes for diabetes, and which medication is right for you is also going to depend on your personal health risks. Now, in case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hey guys and gals, keep those questions coming. Speaking of which, here's one from our very own website, allhealthtv.com. Hey, Dr. Kaur, My name is Alberto, and I've been having occasional chest pains, which I've always attributed to heartburn, but I've also been feeling kind of sluggish lately. I'd like to get your opinion on this. Hi, Alberto. Thank you so much for sending in your question. Unfortunately, I can't diagnose you over the phone, but based on what you're telling me, I'd recommend that you make an appointment with your primary care physician as soon as possible. In fact, if this chest pain gets worse, or becomes more frequent or really changes in any way, you really want to get it looked at. You might even consider going to an emergency room at that point, especially if you're older than 60, because chances are it's a heart condition. Sometimes those heart conditions can be detrimental or even fatal. Now, I hope it's just heartburn, but as they say, better safe than sorry, right, Alberto? And speaking of heart disease, here's a video from our friends at the Mayo Clinic.
The heart keeps us alive, so having heart disease can be a very important factor in how long we live.
Heart disease is a big term referring to any disease of the heart.
Now, the most common cause is coronary artery disease.
And that refers to a buildup of plaque in the arteries. Over time, it can lead to narrowing of arteries and risk of a heart attack.
A heart attack is when a part of the heart muscle dies because it is deprived of blood flow or oxygen. Or it can be due to the heart having to work really, really hard that outstrips the oxygen supply.
Most coronary artery disease is preventable, says Dr. Hayes.
If you're smoking, stop. If you're a couch potato, get off and start taking 10 or 20-minute walks every day. Physical activity is medicine.
Know your cholesterol and blood pressure numbers and maintain a normal weight. These are all ways to help reduce your risk of heart disease.
Welcome back, everyone. So we've got a question from Doris, and Doris is one of our YouTube viewers. She says, I'm not sure if these are chronic diseases, but my granddaughter keeps telling me to get vaccinations for COVID, flu, and RSV. I'm 73. Do I really need them? I thought vaccines just for children. I'm so happy you asked this question, Doris, and please thank your granddaughter for me because she's taking really good care of you and her concern is just very heartwarming. Now, COVID, flu, RSV, pneumonia, shingles, whooping cough, these are not chronic diseases, but they are infectious diseases, and it's important to get vaccinated for them, especially the older that we get, because if we contract them, we can have a higher risk of complications, and some of them can even be fatal. So we really want to make sure we're doing what we can to prevent these diseases. Now, everybody knows COVID, influenza, RSV is more known now, pneumonia, and honestly, even whooping cough. But shingles is one that not many people are familiar with. And shingles is very important because it can be a very, very painful infection. But not only that, once the infection goes away, it can actually leave long-lasting damaging effects on your nerves, and that can cause pain for weeks, for months, or honestly for even the rest of your life. And that can be quite detrimental to your life. So please talk to your primary care physician about a shingles vaccine and if it's something that you should be getting. Now, just in case you missed it, for those of you who didn't catch it the first time, here are the ways to send in questions for our viewers.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back, everybody. So it seems that we have a question from another viewer of ours, Patrick. Let's see. Patrick says, I have to see the urologist for the first time in June. Do my regular doctor and the urologist communicate regarding my health? This is a fantastic question, Patrick, because I personally am a huge advocate for comprehensive care. And what that also entails is me talking to your specialty providers. So yes, your primary care physician and your specialty provider, no matter what specialty is, should communicate about your health care. Generally, what happens after you see a specialist is that office will send that doctor's notes to your primary, so we're kept in the loop, and so we can make sure that we're all on the same page about your treatment. That reduces medical errors, it increases how we're trying to treat you and how our outcomes will be, and then honestly, it's just a better level of care. So yes, your urologist should be and will be contacting your primary care physician. Now, that was a great question. Let's see what else we have. The questions are just coming in, and I'm honestly just having to pick and choose which ones are coming in. All right, let's see. This one is from Rohit. Now, Rohit says, my 65-year-old wife, Bhavna, lost one of her close friends a few months ago due to Alzheimer's. She's been pretty depressed about it, and now she's worried that she might have it too because she's starting to remember things. Sorry, having trouble remembering things. I'm so sorry to hear that, Rohit. Alzheimer's is one of the most devastating diagnoses that one can get, not only for the patient, but for the family members as well. Thank you for sharing your story. Now, I'd like to answer this question by first explaining that Alzheimer's is a type of cognitive impairment and science has not yet identified a particular cause of it. We're still working on that, but what we do have are ways to diagnose it and to manage it. Now, backing up a little bit, cognitive impairment in simple terms means that a person is experiencing a decline in one or more of their cognitive functions. So their ability to make decisions, their language and memory, their complex and critical thinking skills, or sometimes just using their judgment and concentrating. And when that decline starts to interfere with our daily activities and daily life routine, that's when we determine that it's a disorder. And that's when we start to think that we need to look into this a little bit more. Now, that's also known to most people as dementia. Cognitive impairment can be due to a variety of causes, including, not limited to, medication side effects, metabolic or endocrine dysfunction, an illness like COVID or pneumonia or a urinary tract infection. Depression can also cause cognitive changes, and not a lot of people recognize that. So that's something to keep in mind as well. And then dementia in general, which includes Alzheimer's dementia, something called vascular dementia, and then a third type called Lewy body dementia. Now, although we do occasionally see vascular and Lewy body dementia, it's Alzheimer's disease that makes up 60 to 80% of dementia cases, and nearly 7 million Americans have dementia. Sadly, it's the number of deaths from Alzheimer's disease has more than doubled between 2000 and 2021, and that's just a devastating statistics. Now, vascular dementia is the type of dementia that onsets after you have issues that are happening in the brain that limit the blood flow to certain parts of the brain, mostly the parts of the brain that are responsible for your cognition. Vascular dementia can happen, say, after a stroke. If you start to have symptoms of dementia, then we term it as having to do for a vascular reason. Then there's Lewy body dementia. Funny word, but very important to know. Cognitive changes that result from Lewy body dementia are due to little protein deposits, and these deposits are called Lewy bodies. They tend to deposit in certain areas of the brain and cause dementia and cognitive impairment. The one thing that makes Lewy body dementia different from the other ones, though, is that it comes with hallucinations, or it can come with hallucinations. Now, regardless of the type of dementia, I'm sure you can see why it is so important to screen for it, to diagnose it, and to manage it. It could really pose serious life altering challenges for not just the patient, but like I said, also the patient's family and their caregivers. So the sooner it's caught, the sooner we can do something about it. Now, the screening for dementia generally starts around age 65. During your 65th annual wellness exam, your PCP may administer some tests that test your cognitive function. Some of these are the mini mental examination and then the Montreal Cognitive Assessment. And speaking of cognitive impairment, let's see. Our next YouTube question deals with Alzheimer's. Let's see. Alma. Alma says, my husband was recently diagnosed with Alzheimer's and I'm wondering what I can do to help. Oh, Alma, I'm so sorry. I really, really hope that you guys are dealing with this in a strong manner. You have a good advocate and you have a good medical care team with you that's guiding you through this. And thank you so much for reaching out. Now, there are several management methods for Alzheimer's disease: medications, nutrition, lifestyle changes. There's cognitive rehab and therapy as well. Exercise programs. Exercise is oh so important. And honestly, one of the most important ways to manage it is the support of your friends and your family. That social support network, that strong social support network is so important. Now, management of Alzheimer's also includes addressing the caregiver as much as the patient. So, very, very important to include everybody. Now, more important than treating or diagnosing Alzheimer's, believe it or not, is preventing it. So how do you do that? Well, although our research has not yet found one specific thing that prevents Alzheimer's 100%, the following, are some ways that have possible benefits. And some of these are, again, exercise. Now, exercise does so many good things for the body. There's so many good chemicals that are released. There's endorphins, and all these things work in different ways in order to improve your cognition, improve your mood. So you really want to take physical exercise seriously. The other thing is maintaining a social interaction, maintaining regular social interaction with your family and friends. Believe it or not, that also increases endorphins and other positive chemicals in the body. Then there's engaging in regularly stimulating, mentally stimulating activities like crossword puzzles, puzzles in general, anything that makes you engage those critical thinking skills. And regularly engaging in those will keep your mind sharp. And then the last one I want to mention is eating a nutritious and healthy diet. I know we've honed in on it many, many times, but it's so important to get all your nutrients and those good vitamins going into the body. Now, in addition to dementia, another set of conditions that is often misdiagnosed in the elderly population is depression and anxiety. And though it's quite common nowadays, it's still not diagnosed as much as it should be. Your primary care physician serves as a central figure in your healthcare journey. So I really, really hope we've helped educate you on that today and helped emphasize that today. Your primary care physician shows you the importance of your conditions, your health, your prevention methods. So as you can see, yes, your PCP is an integral part of your healthcare journey. Well, guys, that's it for this episode. I hope I performed well and gave you some good information, answered your questions well. Please do tune in every day, 12:30 for the next episode. Thank you for watching. We'll see you again at Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.